In this presentation, I will tell you shortly about the clinical studies we have done it here at Injeq and what are the benefits of we found in these studies. The state of the art for lumbar punctures is that you choose a proper needle for the intended medical purpose, and that it suits for the specific patient group. And sometimes you need some guidance which is needed for the appropriate performance of the procedure. Typically, the guidance is achieved with ultrasound imaging or computed tomography-based fluoroscopy. Here at Injeq, we have developed a needle which is based on bioimpedance measurement. And bioimpedance, it describes how the biological tissues impede the electric current flow. The bioimpedance depends on the tissue type. Fat has the highest impedance and the cerebrospinal fluid has the lowest bioimpedance. And also the magnitude of bioimpedance depends on the frequency we apply. Our device, our bioimpedance needle, it has very high spatial sensitivity and it can perform the measurement in real time. So when we were developing our device, we have to first define what is the clinical benefit. So we defined it as a successful, precise and safe lumbar puncture, which is medically indicated for patients' diagnosis, monitoring, intrathecal treatment or spinal anesthesia. And as parameters of performance, we define success, precision and safety. And to get some data for these parameters, we have conducted 3 clinical studies so far. The first study was a feasibility study in adults, and the second study was a feasibility study performed on neonates and infants. And the third study was the study which Sauli told about. It was the pivotal study showing the benefit of our product. And what about the success as a parameter in adults? The CSF was reached in over 90% of the cases, and this was only to show that we can perform lumbar punctures with our product. And the study of neonates and infants, it was a bigger study, and there we showed that the CSF was obtained in the first attempt in 90% of the 28 cases where we got the CSF sample. And the success at the first attempt was 90%, and it's very high value in compared to literature. Although we have to remember that our study was quite small. And the incidence of traumatic lumbar punctures defined as 10,000 red blood cells in microliter was 18%, and that's also very low value. And Sauli told you about the pivotal study of pediatric oncology patients, so I will not repeat these results, but you can see them in the slide. And regarding the functionality of CSF detection, we had the precision data, and in adults, the CSF was correctly detected in 92% of cases. And in neonates and infants, and also in pediatric oncology patients, the detection, the sensitivity was similar, close to 90%. And the false detection of CSF declined with time. In the latest study, it was below 10%, and it develops all the time. And regarding safety, we didn't observe any adverse events in any patient group. And the low incidence of traumatic lumbar punctures, that means the blood contaminated CSF samples was very low, both in neonates and also in pediatric oncology patients. And also the low incidence of post-dural puncture headache, it is the lowest value reported in pediatric hemato-oncology patients using the same size spinal needle and same type spinal needle. And other benefits we are expecting, as Sauli already told us, that the use of IQ-Tip needle facilitates clinical skills and learning of novice medical students. And we are also studying the effectiveness on performance and safety in pediatric patients in randomized control studies, both in Finland and also in Germany. The Germany study will start soon. And compared to conventional spinal needle, the overall success with the IQ needle, it was 90%, and it was only 40% with the conventional needle. So I think I have also done my presentation. Thank you very much.